Hi everyone, welcome back to my YouTube channel, Happy Healthy Smiles. Thanks so much for joining me. Hope you guys are all doing well. My name is Farah. I'm a registered dental hygienist, just here to help you improve your oral health, which in turn will help you improve your overall health. So today we're talking about different conditions of the tongue, and it's really good to check when you're brushing. After you brush, stick your tongue out, check, make sure everything looks healthy and normal. So number one condition is to look out for is it's called strawberry tongue. It's swollen red and it's bumpier than normal. So kind of resembles a strawberry. Sometimes if you have a food or drug allergy, you might notice this red swollen tongue. And another a sign could be if you have a vitamin deficiency like a B12 or folic acid deficiency. And in rare cases of scarlet fever, that could cause a strawberry tongue. A second condition is called a hairy tongue, or it's also known as black hairy tongue because it gets a black coating on your tongue. Now, everybody has papillae on their tongue. They're like hair-like projections. That's normal, but some people have longer papillae than normal, and these elongated papillae will trap a lot of food debris, a lot of bacteria, a lot of different substances, and cause black hairy tongue. And it could be from poor diet, like soft diet. It could be poor oral hygiene, a dry mouth. If you're using or overusing a mouthwash, which has oxidizing agent like peroxide, can cause it. If you've been on antibiotics, and some of the antibiotics increase a pigmented bacteria that can cause a black hairy tongue. Excessive amount of smoking, definitely that's a very common cause. It doesn't have to be black hair, it could be brownish or a dark brown or even very white coated tongue. Also excessive amount of tea, coffee. So as you can, any dark substances will leave a coating on your tongue. And all you have to do is make sure you clean the tongue, and I'll go over that at the end of what you can do. Another condition is called a white plaque tongue. It's a white coated tongue. Again, if you have longer papillae than normal, which will trap food debris, it'll trap bacteria, dead cells will accumulate, and that'll cause a coating on your tongue. Now, you don't have to have longer papillae. Even if you have normal length of papillae, you can have a white coated tongue. And it usually is caused by poor oral hygiene, a dry mouth, dehydration, tobacco use, excessive alcohol use. If you're a mouth breather, that tends to create more plaque, and you might have a coated tongue, a soft diet. And a fourth condition of your tongue is called a geographic tongue. A geographic tongue means there's a red patches surrounded by white patches on your tongue, and they have like a map-like appearance, so that's how you get the name geographic tongue. And these patches sometimes will change positions. So sometimes they appear at the front or the back or the side, and they can last a couple of weeks or years. And the cause is really unknown, but one is maybe hormonal, I think, and it could be stress related. And it doesn't cause any long-term health conditions. So there's really no symptoms for this. So it's just a typical red patches without any symptoms. Another condition of your tongue is caused by thrush. Thrush is a overproduction of yeast bacteria, and you'll get white lesions on your cheeks or your tongue. And if that happens, come into the dental office or see your doctor. Will probably prescribe some for that. Another condition is called Lichen Planus. It's like white lacy patches, and it could be on the cheeks and sometime on your tongue. On the tongue, it appears like open sores. And actually, I just had a patient with that, and it looked like it was a cut on the tongue. And sometimes if it continues and it doesn't go away, we'll send you for just a biopsy just to check, make sure there's nothing else happening. And another cause of tongue issues is when you get blisters or canker sores, which are common. But just remember, if these don't go away, if they get bigger or more painful and they last more than a couple of days, please make an appointment to see your doctor, but especially your dental professional, and have them checked out. And you notice a lot of these conditions, there was common factors like poor oral hygiene causes these, soft diets, tobacco use. Those were all very common in all of these conditions. So make sure you have a healthy mouth, and also dry mouth was one of the also conditions. So always keep hydrated, keep your mouth moist, and use either a toothbrush, but I prefer if you get a tongue scraper, and Gum is one of the brands that make really good tongue scrapers. So you just stick your tongue out and just sweep across, and cleans really well. So I would really encourage you to make sure every single day you are cleaning your tongue. Check it out, make sure everything looks normal. Anything looks abnormal, come and see your dental hygienist or your dentist. Hope all these tips helped, and if they did, hit the like button and don't forget to subscribe. Hope to see you soon. Bye.